Today, we're going to talk about the evidence of coverage, or the EOC. If you've watched these in a certain order, you may have already watched the video on the summary of benefits document. That was a shorter document that gave you very high-level highlights of what your plan actually covers. In this video about the evidence of coverage, or EOC, what you're going to see is all the details around that coverage. How do you find your physician that's in network? How do you find your in-network pharmacies? How much are you going to pay? Are there any restrictions as to why you can or cannot go to certain physicians? And how do you get referrals if they are needed? All of that information you're going to find in your EOC. For today's video, we are going to use Blue Cross Blue Shield South Carolina as our example Medicare Advantage plan. And you're going to go simply to Forms and Policies, and then we're going to scroll down, and today we are going to be using their total PPO plan. Again, PPO stands for Preferred Provider Organization. And we're just going to pick one of these plans here. We're just going to pick this Total Midlands Coastal PPO Evidence of Coverage. So once this comes up into a PDF document, you immediately see that it's 220 pages long, okay? From our summary of benefits document, that was anywhere from about 19 to, or actually about 15 to 26 pages. You can see this one is exponentially larger. What we're going to do in this video is we're just going to highlight how you actually use this document. What are some of the main things that you can get out of it? And then there's going to be a series of videos that go over what you actually find in depth in the evidence of coverage. So as you scroll through the document, the very first thing you're going to see is going to be the plan year. This is very important, okay? So you want to make sure that you're actually looking at the correct document for the plan year that you're in. So this is January 1st through December 31st, 2024. It says the evidence of coverage, and here it's going to give some contact information for the most part. It's going to tell you everything that this document is going to explain and what you're going to get a better understanding of, okay, in this section right here. Then we're going to scroll down and we see our table of contents. So in the table of contents, what you're going to notice is that there are chapters and then there are sections. You're going to have a total of 12 chapters and then different sections under the chapters. We're going to go through the chapters separately so that you can get more out of each of these sections without having to watch a very long video. So what you're going to notice is chapter 1 is getting started as a member, okay? And so these are going to be just high-level things of what does it take for you to be in this plan? How do you actually get started? And then the next section is your contact information for the plan if you actually needed to contact them. You'll also see there's contact information for Medicaid and Medicare. Cool thing is you can actually click on these in the table of contents and it will take you directly to that section. All right. And then chapter 3 goes over how do you use your plan for medical services. So this is more of the how you actually use it. And then section 4, you'll get into the details around what do you pay for those actual services for under the medical benefit. And then chapter 5 is going to be using your plan for prescription drugs. So how do you use your plan to get your prescription drugs? Chapter 6, what do you pay for those actual drugs? And then in chapter 7, maybe you received a bill that you think you should not have received for a medical service or a covered drug, and then you want to know how that plan can actually reimburse you for that. That's going to be in chapter 7. Chapter 8 is going to be your Medicare rights and responsibilities. Chapter 9, what if you have a problem, complaint, grievance? How do you file those? What are the steps? Chapter 10, say you no longer want to be in this plan. It's going to tell you how you can terminate it. And then chapters 11 is just going to be there to give you this legal ease and legal notices, non-discrimination notices, those type things. Chapter 12 is going to be definitions of important words, which I'm excited because I'm going to break those down into shorts and so that you can actually see in depth what those particular words mean and how they may apply to you and your benefits. Now, this is a Medicare Advantage prescription drug plan evidence of coverage. And remember, MAPD, or Medicare Advantage prescription drug plan, covers both your medical benefits as well as your prescription drug benefits. What I want you to see is also a prescription drug plan EOC, meaning they only cover the prescription drug plan. So we'll scroll down and we'll find one that covers just your prescription drugs. So here's one EOC. And so it's the 2024 evidence of coverage. There's your title page. You can see this page here looks very similar to this page. And that's all because these are what we call model documents. So CMS, which is the Centers for Medicare and Medicaid Services, releases out these templates every year for all plan sponsors, all insurance plans, to have a guide by which they are to disseminate this information out to Medicare beneficiaries such as yourself. All right, so what I want you to notice is the PDP or prescription drug plan only actually has 10 chapters, whereas our MAPD plan had 12 chapters, okay? And so some of it's similar, but it's 2 chapters short because guess what? Because the PDP plan does not cover medical benefits, you do not need any of the chapters that talk about medical benefits. So therefore, you're only going to have 10 chapters in this in the PDP EOC. You'll see very similar. It's going to tell you how do you get started as a member, your important phone numbers and resources, how do you use their prescription drug plan, what you're actually going to pay, asking the plan to pay part of the cost of your drugs if you feel that you got a bill and you should not have, what your rights and responsibilities are, how can you complain and grieve, if you want to leave the plan, your legal notices, and then definitions. So this document's 114 pages. This document is 220. And the rest of that difference, because this is an MAPD plan, is all about how and what you're going to actually be paying for your medical benefits. So I hope what you can see so far from these 2 documents that they're very similar. You just have to make sure that you have the one that is accurate for the plan that you're in. Once you get into the document itself, it's going to have a chapter. So it has chapter 1, getting started as a member. And then as you scroll up at the top, you're going to see the title again. So making sure you're in the right plan that you're in. We're still in the 2024 evidence of coverage for Blue Cross Total Midland/Coastal. And then it gives you the chapter again, getting started as a member. And then you see section 1, introduction. And then the sections are further broken down. So section 1.1, it says you are enrolled in Blue Cross Total Midlands Coastal, which is a Medicare PPO. And then it goes into this information. Then you see section 1.2 and section 1.3. What I want you to be mindful of, say you've scrolled down some, and he's like, oh, I'm in section 1.1, but what section 1.1 of what? This doesn't make sense. You refer right back up here to your title. That's in the header, and you'll see that now you're on chapter 3, using the plan for your medical services. And this is section 1 and section 1.1 that is applicable to this chapter. Next, we're going to scroll all the way down to the definitions. We're going to go through all of these sections, but I do want to show you the definitions section in case you're going through this document and you're like, I'm not for sure what something means. So if that is the case, you can come down here and you will actually see all of the definitions. And these definitions, some of them came from the model document, meaning CMS says, hey, plan sponsor, these are some of the words that we've used in this document. Please include these definitions, but also it allows plans to include definitions for words that they may have included in the document that CMS may not have already had in the document. And so if you're always wondering, well, what did you say CMS was again? So it's Centers for Medicare and Medicaid Services, and it's the federal agency that administers Medicare, okay? So this is where you can actually go and look and see what these actual terms mean. So that is the introductory video for the evidence of coverage. We're going to break down each of these chapters into different sections. And I'm going to actually put these into a series. So you'll actually be able to say, I only want to know more about section 3 of chapter 4 today, or whatever it may be. You can, instead of having to go through a 2-hour-long video, you can see these broken up into snippets. So please remember to subscribe to this channel, hit the like button, and if you enjoyed this video, and please hit the notification bell so that you know when other videos come up as we go through different documents within this plan document series.